Professor Lee, and this is our Chapter 4 Key Points lecture for the Introduction to Health Insurance Portability and Accountability Act. So we start with the HIPAA privacy rule, and the privacy rule applies to anyone working in the medical office or in the healthcare field. We must comply with this HIPAA privacy rule in helping to protect protected health information, or PHI, in all of our interactions with patients, with their family members, providers, insurance carriers, and others. So this includes things like protecting your screen from people at the counter when they are checking in, from protecting files, from protecting any information that is not to be shared with insurance carriers or family members or otherwise. So the HIPAA privacy rule regulates the use and disclosure of that protected health information held by healthcare clearinghouses, by insurance carriers, by health plans, and by medical service providers. So with this, we have the definition of the PHI, which is that protected health information, and that is going to be any information via paper or electronic that is held by a covered entity that concerns a patient's health status, their provision of care, which is the way that they were provided care, and or the way that they have paid for their care. So basically what you want to remember is that anything to do with a patient's health care is going to be considered to be private health information or protected health information. So, let me go back. So there are some rules about how we disclose protected health information to others, including the patient. So most of the providers require documentation of the patient's consent to release their protected health information by having a patient sign a form which authorizes the disclosure of that information. So when the patient is a minor, a parent or a legal guardian can sign on the child's behalf, but if the patient is an adult that is not incapacitated in any way, then they should sign their own release form authorizing the disclosure of that PHI. So prior to treatment, a designation for release of medical information form is completed, and then it's going to be signed by the patient to specify with whom a provider can share their information. And so on that form, it's usually one of the forms that is in that initial packet that you fill out when you go to the doctor's office for the first time, and then it's typically filled out annually after that, but it's updated every so often, and you list down who can have access to your health care. So if I'm filling out a form for myself, then I would list my husband as as the person to have access to my health care in case I am unable to. For my children, it's myself and my husband. So it's basically who that provider is allowed to share your information with. Okay, so we have a couple more rules about the way that we are allowed to disclose this protected health information. One of those is sorry, I had to flip back to the right slide. One of those is that healthcare providers must appoint a privacy compliance officer, and that's going to be the person who handles the request for medical records and makes sure that they are being released in a compliant fashion with HIPAA regulations. Providers are also required to release PHI in response to a court or administrative tribunal. They have to ensure that only the protected health information that has been expressly authorized by the order is disclosed. And so what that means is if a person is suing for like malpractice, medical malpractice, and the court subpoenas their file. If they are suing for medical malpractice about, say, an appendectomy that happened in September, the provider or the office, the privacy compliance officer, can only release to the court the information surrounding that appendectomy that happened in September. If that person has been seeing the provider for 10 years, they can't release anything that has occurred before or after that September appendectomy, only what the court asked for and only for that specific reason. Okay, so next we have our patient rights, and the patients have rights as well. Oh, this thing is killing me. The patients have rights as well. They have the right to access their medical records, and they have the right to review the information that is contained in medical records and to request that a covered entity, so the provider, corrects any errors in those records. So anytime a patient doesn't agree with the information that has been recorded in their medical record and they have reasonable cause to believe that there is misinformation in there, they are allowed to request that that provider correct any of the errors that they believe to be in the chart. So one more patient right, upon request, upon request, the covered entity must provide the requested information or correct inaccurate information within 30 days. So if a patient says, hey, I noticed here that you said that I quit smoking in my chart, you documented that I quit smoking 10 years ago, but really it's been 12, then they have to correct that information within 30 days. If any records are subpoenaed or if they are requested by the patient, then they have 30 days to produce those as well. So we have some security standards that are covered under HIPAA that we need to know about as well. This thing is always just a hair faster than me. There are requirements for the electronic transmission of protected health information. The electronic PHI is encrypted. It has to be encrypted or encoded to prevent unauthorized users from gaining access to the data. And also, an entity that transmits protected health information electronically must do so according to the Electronic Data Interchange Standards, which is another law that protects how this information is shared. So, as you can imagine, there are penalties that come with not releasing this correctly, and there are two major types of penalties. There are civil penalties, which penalties tend to be on a tiered or a kind of like a pyramid structure for HIPAA violations, and that tiered structure was established way back in like 2009, so 11 years ago already. HHS, which is the Department of Health and Human Services, is the one who determines the penalty amount, and that amount is heavily dependent on the nature and extent of the HIPAA violation. And then there are also federal crime penalties, and those kind of revolve around violations that are considered criminal fraud and abuse, and those can result in financial penalties of less than $50,000 up to as high as $250,000 and 1 to 10 years in prison. So when it comes to medical assistants, nurses, rad techs, anybody kind of in the allied health field, then the civil penalties for HIPAA violation is what is most commonly assigned. But when it comes to providers and major entities, hospitals and insurance companies, they tend to look more towards the federal crime penalties. Now, I'm not saying that that could not be vice versa, because it definitely can. It's just that's kind of the nature of things. Okay, so next we have meaningful use. And meaningful use is the health information technology for economic and clinical health that is called the HITECH Act of 2009. And that HITECH Act introduced the concept of meaningful use. So what meaningful use is it's a set of these very specific requirements that are related to the implementation of standardized, certified, interoperable EHRs, which is our electronic health records, and the related technologies that are needed to support those EHRs. And so basically, the government said, hey, we want everybody to adopt the use of electronic health records. So, 10 years ago-ish, maybe not quite 10, but everything was still being paper charted. And so it made it very difficult for continuity of care for patients to, have all of their health records sent all over the place. So this HITECH Act encouraged and provided financial incentives for offices to adopt these EHRs. Now, EHR systems are pretty expensive, and so for a while, only larger offices had to adopt them. And then I think by 2014 or 15, everybody had to be working on these electronic health records. And so what these EHRs have done is they have made the continuity of care amongst providers for one single patient much easier. And to give you an example of that, we moved from the Midwest to California, and in the Midwest, our physicians and hospital network were all on an EHR called Epic. And Epic is a nationally used electronic health record system. And so when we moved to California and I was looking for a new neurologist for my son, I was able to find one who also used Epic and then have years and years of MRIs and CT scans and health data from his record in Indiana just ported over to his health record at Children's Hospital with this. I mean, it was so easy. All I had to do was sign a form. And after I signed that form, all of his health data that we had been collecting for 12 years prior to our move was available to his new physician here. So that's kind of how EHRs are beneficial. There are definitely some setbacks, but meaningful use is designed to help address those setbacks. So with the meaningful use, it requires that healthcare organizations adhere to very specific standards for their electronic health record systems, and those providers must meet specified objectives in the use of EHR systems to qualify for Medicare and Medicaid incentive payments. So a large portion of the United States population is receiving health insurance coverage from either Medicare, which are older patients, or Medicaid, which are our patients who are unable to get health insurance on their own due to financial issues. So the way that this meaningful use has impacted the way that we give care is pretty substantial. A couple of other things that I did not type in here but that you should know is that one of the stipulations or requirements of meaningful use is that no one can access an electronic health record unless they have formal training, education, and credentials. So that is one more reason for you to sit for your certification exam so that you can be compliant with these high-tech meaningful use laws in order to be able to access a patient's medical records. All right, so I think that's it for this lecture and the key points. If you have any questions, please reach out and let me know, and I'll be happy to answer them. Thanks.